At first glance, this plant is nothing more than just that, a plant. But to a trained scientist's eye, flora like this holds key ingredients to many of today's medicines. Known as phytochemicals, they've shown to have positive effects on the various diseases plaguing our modern society. The advent of these plant-derived medicines, also known as nutraceuticals, is gaining momentum in the healthcare industry. But harvesting these elements is no small task. They are often found deep in the jungle and require years of research. This story takes us to the heart of the rainforest.
One of the things I do get to do is live with local tribespeople in different cultures in different parts all over the world, and I see how their tribal chiefs or their medicine men or whatever you want to call them, shamans, use some of the local plants to cure disease. And it's my job to study those plants and to figure out what active phytochemicals or what compounds are in these plants that cause them to work the way they do.
Once developed, these natural agents are put to the test to see how they work with diseases.
When they were highly standardized and in right amounts, my experience shows phytochemical interventions were much more effective than just simple dietary changes. I could find out how some phytochemicals, including polyphenols, carotenoids, curcuminoids, glucosinolase lignans, etc., can safely improve various conditions through synergistic combination.
What's been found is that certain nutrients administered in therapeutic doses may help support the immune system and restore some of the body's biological functions that have weakened over time. As a result, the effects of diseases like diabetes, heart disease, cancer, and Alzheimer's disease may be diminished.
The different substances will react differently with different parts of the body, obviously. But for an example, if you take calcium and vitamin D and menacamine 7, you will promote osteoblastic activity, which will reverse osteoporosis, which is especially important with women as they tend to develop osteoporosis as their hormones start to diminish with age.
What most people don't understand is that all drugs had their origin in some plant or some animal. And if there's a way to where we can actually teach people that there are options, that there are viable, clinically proven phytochemicals that exist in plants, that they have a choice whether to take this proven phytochemical, which by the way has very little side effects and will cost them a lot less money, or to go ahead and take the synthetic drug. At least they have a choice. And they have a choice that may save their lives and save them lots of money. Our research is catching up, and we can show that some of these natural formulas and phytochemicals are just as effective, and in some cases more effective, than the standard treatments of synthetic drugs right now.
I had colon cancer, third stage colon cancer, and it didn't look very good. They told me unless I took the chemo and the radiation, that I would probably be dead within 6 months. And even if I took the chemo and the radiation, it didn't look good either. So it was very depressing, to say the very least. I chose not to take the chemotherapy and the radiation. A good friend of mine told me to go visit Tracy Gibbs. So I went to visit him, and it was like the sky opened up. And lo and behold, in 6 months I took my first test, and I was cancer-free. And it's been 4.5 years, and I'm cancer-free today, too.
Developments in the nutraceutical industry are turning heads and could change the landscape of healthcare, greatly improving the quality of life for many.
Genepic is our answer, I guess, to the latest research and findings that we've discovered. It has specific phytochemicals that target ATP inhibition, which basically inhibits cancer cell growth. It also has some anti-tumor properties to it. There's about 8 very potent phytochemicals in Genepic, along with a slew of vitamins and minerals that could be used as an adjunct for somebody taking chemotherapy to help keep their blood counts normal, to help keep their white blood cell counts normal while they're on the chemotherapy. We really see Genepic as the future of integrative medicine, combining clinically proven phytochemicals with standardized treatments.
The most intriguing part to me is that we were able to discover from nature something that was extremely efficient in working with disease processes, in our patients. These natural agents can work with a myriad of diseases and disease processes without completely debilitating the patient. They are cost-effective, they are renewable, they will always be with us, they can always be found. We do not have to produce them synthetically.
This is similar to how we treated our patients in Korea. To care for cancer patients holistically, not just fight against cancer. Well-balanced nutrients, phytochemicals, and specific enzymes in Genepic will be very helpful to practitioners as well as patients.
Dr. Hong, head of Academia of Anti-Aging Medicine and Director of Research Initiative, has conducted extensive research and used in clinical practice many of the food-based nutrients like those found in Genepic. His findings are impressive.
The naturally designed formula under this concept showed significant reduction in fasting insulin and triglyceride levels, suggesting better insulin sensitivity, suppressed oxidative stress markers, and better estrogen metabolic profiles, all leading to tumor growth suppression, regression of enlarged metastatic lymph nodes, better tolerance to toxic chemotherapy, and enhanced NK cell profiles relative to those of the same cancer stage patients. NK cells are renowned for the ability of perforating cancer cells with special proteins named porphyrin and granzyme. Overall, we found that our interventions inhibited cancers not just through a single mechanism, but through the multiple aspects involved.
Positive outcomes have also been seen in Alzheimer's patients who are taking Genepic.
I was asked by Dr. Osgothorpe to evaluate the efficacy of this formulation for seniors, particularly